Welcome. This is an Iowa Online Nurse Residency Program Resident Spotlight with Program Coordinator Amanda Bruscher. Today's guest is RN Taylor Jackels from Ridgeview Medical Center in Waconia, Minnesota. Taylor completed the IONRP in March 2024.
Thank you, Taylor, for being with us today for your resident testimonial. So we are going to start here. What type of facility or unit do you work on?
So I work in a hospital setting in labor and delivery, but that was not initially when I had started working at the hospital, and I was in the residency program at the beginning. I was in the float pool and had transitioned units halfway through the residency program.
Yeah, and how was that for you going through that transition of units during the program?
It was challenging. At first, I had went through 12 weeks of training in the float pool and was by myself for a few months. I was in the float pool for a total of 6 months and had made that transition. It was challenging to be a first-year nurse and having so much, everything was new. I was orientating in multiple different units, and it felt like I almost couldn't stay caught up with learning or staying organized because every day was constantly different, especially after moving units.
So Taylor, what did you find to be the most beneficial aspect of the program?
I found that the program was almost an outside of work, an outside of school, if you could say, support group. So coming from graduating nursing school, transitioning right into the workforce, I had no idea that I was going to be in a nurse residency program at the beginning. Having the nurse residency allowed me to have a support group where we were able to talk about really raw conversations or raw topics that weren't always talked about in school, aren't always talked about at work. It was almost just like a area where you could ask absolutely any question, not even necessarily related to work, but about your mental health and just leaning on them for that transition or that change in your life.
Yeah, I love that, Taylor. And how did you apply the concepts covered in the program to the area that you work?
Initially in a float pool unit, transitioning to OB, I had applied just really my critical thinking that the program had really talked about how to transition from the school mindset to work. How do you necessarily start to critically think? They had taught just the importance of communication throughout your unit, whether it be delegating tasks, whether it be communicating your struggles or your needs or your ideas, that really any change or research most of the time comes from nursing at the bedside if they notice certain things, whether it be just quality control or changes in day-to-day practice. So the importance of communication and I think critical thinking was something that I was able to apply almost directly to starting work.
And I know during the program, we touched on communication pretty often throughout our conversations together. So that's great. And in the program, what was your professional experience focus?
My professional experience focus was a change project that I chose to research and study throughout the time. I had initially started the project while I was in the float pool, and it was to have bedside rounding between doctors and nurses, to just have that communication and transparency at the bedside. So when I had initially started, it was a med-surg unit, which I was researching, and during my project about halfway, I had switched units, but it stayed very pertinent to still my unit because bedside rounding can still be applicable to OB as well. So I had got to experience bedside rounding with the nurses and the pediatrician in my unit as they rounded on the babies. And that was something that the unit was actually implementing at that time. So I got to see the other units in the hospital weren't quite there yet, but OB was taking on that change, and what a difference it really made for the patients and for nursing. We were able to just have that clear transparency communication, and it was just such a great feeling to see the difference in the hospital and what a change project can really do for your facility.
Yeah, I love that, Taylor. And I think it's kind of cool how you ended up switching your units, but it's still kind of tied together. And they were kind of working on kind of the same change almost, just a little bit further ahead than the other. I know I've had experience in the NICU and those team bedside roundings. It truly does just bring everything together: patient, family, caregivers, the whole healthcare team. So that's great. And is there anything that you would like to share with current or future residents?
I think really the program is what you make of it and the mindset that you have going into it, whether it be initially you're thinking this is going to be just something extra that I'm doing on top of learning my new job and transitioning in this life role. Like that's just one more thing, but it is what you make of it. And it's not necessarily the extra work that you think it might be, but it's the support system at the end of the day that you're able to look forward to coming to it because you have questions, or it's almost an aha moment when you have the discussion in the group and then you go back to work and something that you just talked about happens, or you learn how to burp an IV bag before you use a pressure bag. And so it really is what you make of it. And being able to lean on your site mentor as well, if you can check in with them and be active and present in the conversations with your site mentor, it will make the program much more smooth.
Well, thank you for coming today, Taylor, and we enjoyed hearing from you.
Yeah, thank you so much.